Innovation is everywhere at APVRS 2025, but few bring it full circle quite like Appasamy. From the front of the eye to the back, they're pushing boundaries across both the anterior and posterior segments. Today, Dr. Carlo Nasol takes us inside the Galaxy Turbo Orbit system, while Dr. Mark San Juan walks us through real-world results with the Supraphob InFocus IOL. Buckle up, innovation is about to get clinical.
We were using multi-diff in 2014. It was more of an IOL that would split light and force focus for our patients. With the Supraphob InFocus, it was a new technology. It was called an extended depth of focus. So all of a sudden, it went from giving patients certain areas of foci to making patients resistant to being defocused. That actually naturally would decrease the associated side effects, your halos, your other dysphotophias. It also makes it easier to use. So for the surgeon, okay, it's actually a very forgiving lens. It's very tolerant in case your computations are a bit off, because we're simply extending the depth of focus. We're not really forcing any points of focus. Currently, I only use essentially 2 products in my practice. So as much as possible, we try to use the EDOF, the Supraphob InFocus, for all patients with normal posterior poles, and even for patients with very thick cataracts, wherein we assess that there is a low risk of having a problem at the back of the eye. For the rest that cannot qualify for the EDOF, we actually use another Appasamy product, the Supraphob BBY, which is your hydrophobic monofocal preloaded lens. Back in 2022, I had the highest honor of operating on my mother's own cataracts. That patient profile is one of the hardest patient profiles you can get for cataract surgery. She's a professional, she's active social life, she's a golfer, and she's the mother of a physician. We trusted the InFocus enough that I used it for my own mom. We did both eyes, and we were able to achieve spectacle independence. Apart from the equipment, we also used the Galaxy microscope, the True Glow microscopes, the Galaxy phaco machine, as well as the Cohevis and Aquavis viscoelastic. My mother was very happy. We got her vision back. It was one of the most stressful moments in my life, but since it was a very successful outcome, I actually consider that as the peak of my career.
First of all, the machine can do both anterior and posterior. It can do cataracts, and it can even do retina surgery. By using this system, the efficiency will be better in these certain types of cataracts. The cataracts that can be done on larger machine, it can also be done on this simple machine. The bidirectional power will depend. It's for VR surgeons. For VR surgeons, meaning the bidirectional meaning it's 16,000 cuts. Previously, you have 8,000 cuts. Now it's more of cut rates. If by using the bidirectional cut rate, that 8,000 becomes now 16,000, which is more safer for retina surgery. The higher the cut rate, the vitreous doesn't really move. So having that 16,000 cut rate is a plus. Not all machines can do phacofrag, but having this small machine, having that jackhammer effect, will minimize now the chattering movement of the lens. In this small machine, from phaco to phacofrag to vitrectomy, everything is in one machine. It's an all-in-one machine at a very affordable price. Lens drops, it's no problem. The machine can handle it. Reusable meaning when you buy the cutters, you can just buy single cutters. You don't have to buy the whole pack. So by buying that small pieces, you can just get whatever piece that you need. A light pipe, a cutter, or tubing itself. You do not have to buy the big pack. Not as the older companies that you just need to buy the whole pack just to get a single piece of equipment. This is a very affordable machine. In comparison to the larger machine, you can even buy 10 of these. In comparison to just one machine. So for maintenance cost, a lower machine should have a lower maintenance cost. And if you're a starting surgeon, if you are a starting eye center, this machine can cover the three bases of phacofrag, and vitrectomy, all in one at a fraction of the cost. I would use it. I'd probably recommend it to everyone who's starting out with a new eye center.
Appasamy has been with us since we started in 2011. They've been very supportive because of their comprehensive line of equipment and consumables that it accelerated our ability to complete the equipment and services available for our patient. With that, once we were able to complete our services, and we were able to enhance our redundancy. So we had backups everywhere. All right, we had backups all the time. Since we practice in an island, the service may not be immediate. Before, we would just see something new and then wait for it to come to us. But now we're actually already doing cutting-edge things. We're pushing the boundaries of what ophthalmology can be done.
For today's ophthalmic surgeon, Appasamy Associates delivers a full surgical ecosystem. Platforms, lenses, and everything in between. Built for the way modern surgeons work. Want a closer look at the Galaxy Turbo Orbit or Supraphob InFocus? Get in touch with your local representative. The future of your OR is waiting.